Oklahoma Watch has done a series of reports on prescription drug abuse. I spoke with Oklahoma Watch reporter Warren Veith about their findings. Warren, we're now 2 years into a concerted effort to crack down on narcotic drug abuse. How's the state doing?
So far, there aren't many signs of progress, Dick. Oklahoma doctors are prescribing more of these narcotic drugs than ever. More people are dying of overdose deaths. States doctors are not using the prescription monitoring program routinely to screen out doctor shoppers. And state agencies are not moving quickly when deaths occur to intervene in the practices of these problem prescribers.
Why are there so many prescription drug deaths?
Well, part of this is a nationwide phenomenon, and it reflects the fact that over the last 20 years or so, there's been a movement in the medical community to be more compassionate with pain patients. There are more of these drugs being issued to treat people who have chronic and acute pain, and that's a good thing because millions of Americans suffer from pain and they are leading better and more productive lives because of these drugs. However, one unfortunate consequence of that is that there are much greater quantities of these drugs out there. Patients are taking more of them, more people are dying.
Are doctors overprescribing?
There are authorities who say yes, that's the case. And in Oklahoma's case, we are comparatively overprescribing compared to other states. Last year, Oklahoma pharmacies filled 10 million prescriptions for narcotic drugs. There were enough hydrocodone prescriptions alone filled to give every man, woman, and child in the state 50 hydrocodone pills per year.
Now, are doctors and medical providers, not just doctors, not doing the PMP checks like they're supposed to do?
No, the PMP is an online real-time program that doctors can use, pharmacies can use to see whether patients have been filling prescriptions for the same drugs from multiple doctors at multiple pharmacies. Last year, there were 10 million of these prescriptions issued. The PMP checks were done only 1 million times. So that means for essentially for every 8 of these prescriptions issued, only 1 PMP check is done.
And there are also out-of-state practitioners who are prescribing as well.
There are about 12,000 practitioners licensed in Oklahoma to dispense these drugs. Only about 7,500 of them are in state. Only about 4,500 of those write 10 or more of these prescriptions per year. But the ones who are out of state can't even look at that program.
So the PMP system is not really working as intended?
It's working. It's considered one of the better ones in the nation, but it does have these gaps in the system. An out-of-state prescription writer can't check it, and if the doctors aren't required to use it, and if they don't, then people fall between the cracks.
Are prescription medications a gateway drug?
There are indications, it's interesting, all across the country there are indications that partly because of this crackdown, prescription drugs have become more expensive, the opiate drugs like hydrocodone, oxycodone, fentanyl, morphine. Because of that, some people are switching to heroin simply because heroin is cheaper.
And some people are using heroin and cocaine and a cocktail of various prescription drugs, like the actor Philip Seymour Hoffman, who died of an overdose.
That's right. However, of the 844 people who died of overdose deaths in 2012, which is the most recent year we have data for, 77% of those were prescription drugs. And at least half of those the victims were people who were taking the drugs that were prescribed to them by their doctor.
Warren Veith from Oklahoma Watch, thank you.
Thank you, Dick.